My name is Michael Gnatek. I'm a 43-year-old competitive cyclist from Leesburg, Virginia. I'm several months removed from successful open heart surgery to repair a faulty mitral valve.
Michael had mitral valve prolapse. Some people are born with a valve that has a predisposition to stretch over a period of time, and that causes the valve to leak.
Well, I've known for most of my life that I had a heart murmur, and it wasn't until physical in the middle of last year that my doctor discovered that the murmur had led to something more serious that required open heart surgery.
The big difference at Innova is that patients don't want a traditional operation. They want a minimally invasive approach. They want a shorter hospital stay. They want a quicker recovery.
When Dr. Masmiano first saw me and met me, what he told me was, we'll be doing the minimally invasive. He was very confident and said that I should be back on the bike within a couple of weeks, and he wouldn't be surprised if I was actually discharged from the hospital in 24 hours.
We make a very small incision, about 2 inches long, and we go between the ribs without spreading the ribs or breaking the ribs, and that results in a much easier post-operative recovery for the patient.
I was skeptical about the 24-hour stay in the hospital because I had been told by several other hospitals and surgeons that my minimum stay in the hospital would be 5 to 6 days, even with the minimally invasive procedure. So when Dr. Masmiano came around the next day and told me that I could go home, I was in a state of disbelief.
Our main focus has been on reducing the trauma and the stress of the operation so that the patient can be back at work, or in Michael's case, back on a bicycle within a very short period of time.
Most of my friends and neighbors, they were not convinced that I actually had the surgery. They thought that somehow I rescheduled it or something, based on the way I was walking around and playing with my kids.